Hi, I'm Ava Devine, and you're watching Ava Devine's Bad Advice. So let's face it, I have a lot of adoring fans, and they're always asking me a lot of questions. So I figured, what the hell? Let me make a podcast answering all my fans' questions. Who doesn't want unsolicited bad advice? So I just want to premise, I am not a licensed physician. Do not have a degree in psychology. I just want to give my naughty, bad advice. So I decided to invite a very dear close friend that I've known for many years, AKA my fitness trainer. I mean, if you guys want to know how good and how sexy I look, I thank Kyle, K-Flex Fitness. And I wanted him to be here because he's very logical, very book smart, very hetero. And I'm pretty fluid and nuts and emotional and chaotic. So I thought it'd be a nice, balance. So here he is. Welcome, K-Flex.
Thank you. Thanks for having me on, Ava. As always, it's a pleasure. You look amazing.
Thank you.
And that's right. I've been a personal trainer for about 10 years. Been working with you. You've been my client and my friend now for 10 years. And so I know you've wanted to do this podcast for a while. So it's great to be here with you. Like you said, you're not a doctor. So what we did was we had a doctor come in. So allow me to introduce Dr. Kaplan. He specializes in the area of
sexual dysfunction.
Dysfunction.
Oh,
have you had any questions about that?
Tons. Where's my phone? I have a lot of fans that are asking many questions.
Yeah. So, Doc, what's your background?
So I'm a urologist and practiced general urology for many years. And now I focus purely on erectile dysfunction.
Very interesting.
Then, what are the stats on that?
It's sad but true. About 52% of all men will experience some degree of erectile dysfunction right now. And it's actually very prevalent even among guys as young as 20 to 30.
Wow.
Because of COVID. It turns out that COVID increased the risk of erectile dysfunction by a factor of 6.
Jesus.
So it's not unusual for us to see very young men. But the good news is it's reversible.
Oh, wonderful.
Absolutely. Now, do the stats change as you get older? Because I remember Grandpa talking about, soldier had been dead for years.
Well, if you're a man, eventually your number is going to come up.
Ooh, scary.
Wait. I got to pause for 1 second. Let me just check. The audience and you gentlemen, do I get a Chubb seal of approval by any chance?
Absolutely.
Okay. So maybe the numbers are less. So Dr. Kaplan, I have a question for you. What do you think about the penile implant? Because I had a client one time and I'd have to squeeze his balls and he had the penile implant and his got hard immediately. What do you think of? What's your take on it? Is it good, negative, outdated? Tell me, because this was many years ago.
So the inflatable, there's 2 types of implants. There's a rigid type, the old-fashioned type, and it's hard all the time. Now, you can bend it up and bend it down, but it's always hard. But nowadays, the most common implant is an inflatable penile prosthesis, which has been developed back at my alma mater, Baylor College of Medicine. And the inflatable penile prosthesis has an extremely high patient satisfaction rate.
Good.
And almost everybody will be a candidate for an inflatable penile prosthesis. Now, it's not the first thing you do. It's not the second thing you do. It's pretty much the last thing you do. That being said, almost all guys who will think in their brain, I'm dead. I can never get an erection. Almost everybody would be a candidate for an inflatable implant.
Sure.
A couple of things about inflatable implants. Number one, and this will surprise you, Medicare pays for that.
What?
And most insurances
when it
pay
comes
for it.
time, good old Medicare, that's
so
they won't pay for Viagra or anything, but they get you.
It's interesting, but they will pay for that.
Wow.
Number two, the patient satisfaction rate is extremely high. Number three, if you have an inflatable penile prosthesis and you have an orgasm, you'll still ejaculate the way you did prior to the surgery.
You gotta get that pop shot.
Intercourse is natural.
Yeah.
And when it's deflated, nobody really will even know that it's in there. I mean, they can feel it sort of, but guys wearing clothing, guys at the gym, nobody would know.
Yeah, because he was an older, like maybe 80. He was 80 years old, and when I would squeeze his balls, and I would just watch it, like get harder and harder and harder, and yeah, it was. So I enjoyed it. I had a good time.
There's a transfer of fluid. From the reservoir is generally in the abdomen, and the pump is in the scrotum. So when you depress the pump, the fluid in the abdomen transfers, and it's all self-contained. It's all saline. So they're very durable. They last for a long period of time, and the average implant will last 10 to 15 years. And worst comes to worst, it breaks after 15 years. It could be replaced.
Okay. I do have another question, because another one of my wild experiences, I was with a gentleman that had the dick extension. So I believe he added 2 more inches to his size. And on his downtime, you'd have to have I don't even know, like weights, and it would like tug on his to help stretch it. What do you what is that called, and what do you think about that?
So as glowing a recommendation as I gave for the penile prosthesis, it's the exact opposite.
Okay.
for penile extension. The problem is one of the things that's done is there's something called the suspensory ligament. And the suspensory ligament is there for a reason.
And they cut it.
So they cut the suspensory ligament and they pull out the penis.
Wow.
And that suspensory ligament gives a guy support. So even if you're successful in getting about half of your penis is inside of your body. And so the idea is to bring that inside part outside. But when you do that, you lose that structural support. And so the patient satisfaction rate off the charts for inflatable implants.
Sure.
It's the exact opposite for patients who undergo penile enlargement surgery.
Did you see the Bobbitt thing? I guess so obviously we all know he, got it cut off and she threw it out the window. They found it, sewed it back on.
Yes.
And then he got into porn, and I saw him on Howard Stern. This is a while back. And he was there with a doctor who said, we're gonna make it bigger. And I guess he took one too many chances, but it killed it.
Oh,
it didn't work anymore. Yeah, he looked really sad.
So it was the extension, the penile extension?
Yeah, so I don't remember the exact operation, but they're like, we're gonna make it bigger now. And because I guess, I don't know, if you want to stay in porn for a while, a sewed on isn't interesting anymore. Everyone wanted to see, then they saw, and then they were done.
Damn.
So yeah, but he looked really sad. He's sitting there in his kind of crappy house, being depressed in his chair.
Poor baby.
Did you ever?
Yeah, at least he has the movie Frankenpenis to fall.
That's true.
Is that what it's called?
Yeah, I do remember.
Yeah, you know the name. You know the name.
I think I remember now. Yeah, is it? I don't.
Frankenpenis. He has the one. He's got that.
He's got that. He's got that in his hip pocket.
I love that.
That's amazing.
So So to sum it up, penile implant, thumbs up.
Yeah. Penile extension.
Thumbs down.
Well said.
All right, I love it.
Shockwave therapy.
Thumbs up. Viagra, Cialis. Thumbs up.
There we go.
A finger up the butt. Yep. Thumbs up. So now I have another question for you. What do you think about Trimex?
So the vasoactive injection therapy, what that is where men inject a product into their penis to get an erection.
Which is a pretty big deal in the porn industry, right? Because
it's very common.
So it's pretty reliable.
Sure.
Before we had Viagra and Cialis, and I'm old enough to remember those days.
So that's
what we had. We had Caverject and Trimix, and there's Quadmix. There's all kinds of different.
So it's an old school one. Then.
It's very old school.
Oh, okay.
And so
a little pin in the. That sounds a little.
The needle is not
like an insulin needle.
That bad. It is an insulin needle.
Okay.
And so
on my way around some. some porn. Helped a few. Okay.
The upside is it does work in the majority of patients. The downside is that men get tired of sticking a needle in their penis every time they want to have intercourse.
Sure.
That's number one.
Pincushion.
Number two, it causes fibrosis or scar tissue inside the penis.
Whoa.
So one tends to have to keep increasing the dose. And so
what happens when they stop?
So when they're still a candidate for other forms of therapy.
Okay.
They can be rescued. And even if they've been using injections for years, they're still a candidate for an implant.
Because let's say a guy's in the porn industry and he's using that. So there's nothing really wrong. He just needs to be on when he needs to perform. And now he has fibrosis. So then he has to go in for another. So really,
or the therapy, the Shockwave
we have been
therapy.
able to rescue some patients with Shockwave therapy who are doing injection therapy. The biggest risk of injection therapy is you can develop a condition called priapism. A priapism is a prolonged, painful erection
over 4 hours
that just won't go away. And so
there's that antidote. Right?
Yeah. And
Sorry
so
to jump in.
there is an antidote for priapism, but they can either take Sudafed orally, or if that doesn't work, you go to the hospital and you get an injection of medication, and it's quite a rigmarole.
Ugh.
So that's probably the one of the biggest enemies of Trimix.
Well, I know a nurse practitioner, and she said they drain.
That's
what I heard.
Some patients, particularly patients who have sickle cell, may be prone towards priapism. And so that is one of the remedies is to stick you anesthetize the patient. You put a large bore needle in.
How many gauges are we talking about? What is this, like an 18 gauge?
Well, the problem is that blood, that deoxygenated blood that's in the corpora cavernosa, it's like sludge.
Oh.
And so, so you have to kind of really pull hard to get the sludge out.
Wow.
And you may have to do that repeatedly.
Oof.
So priapism is no joke.
Yeah. Jeez. See,
Yikes.
You thought a never-ending boner was just a good time, but it turns out.
Now, let me ask you this. If you have priapism, if a gentleman has priapism, can the ejaculation take it down, or
probably,
or is that?
Yeah, ejaculation's not going to work.
That's not the cure. That's not the remedy.
Right.
So I have my wonderful fan asking. Okay, you ready, Doc?
Yes, ma'am.
Okay. I enjoy masturbating very often, actually, to your Miss Ava. Well, thank you very much. The only problem is that when I am with a partner, I cannot get fully erect and I cannot orgasm. Is my masturbating hindering my sexual experiences?
Ava, there's almost no such thing as too much masturbation.
Oh, good.
I'm glad we had
I
him
like
on.
that, yes.
Now, you can bring it to an extreme, but for most guys, masturbation is better than not having any sexual activity at all.
Or even the constant stroke off of your hand. Is that hindering a sexual experience?
Probably not.
Okay, really?
Probably not. I mean, unless I'm sure there are extreme cases, but for 99% of the population, all of that stuff is more good than bad.
Oh, wonderful. How about for women too? Because I masturbate a lot.
I don't think that there's any physiologic downside to it.
Oh, good. It's all vibrate away.
So would you say this gentleman that's asking the question is having, a problem when he's with someone, but not? What would you say that's
a lot of times
to?
Guys will have problems with performance anxiety. And since this is towards the end of baseball season, let me make a baseball analogy.
Oh, there you go.
Clever. Love it.
If you go up to the plate and you believe in your heart of hearts that you can't hit the fastball, you're probably not going to hit the fastball.
Okay.
So confidence is very is critical.
Gotcha. So that's kind of where you come in then, right?
Yes. Yes. So I should boost him up and tell him what a great lay he is and how hot it is. And
you're kind of like a third base coach that tells the batter, you can do this.
Well, you know what? Honestly, I feel like I'm a home run, to be honestly. But okay. So you're saying for my fan to ask his partners to like,
relax, to relax.
Okay.
And a lot of times, guys, the first time or the second time, they have a lot of anxiety. But then when they become more comfortable with their partner, their performance improves.
So it only gets better.
So you're saying if he's calling an escort, just to continuously call that particular escort and pay the rate and see that person.
That sounds like sound advice.
I like it. You hear that? I'll give you my number later. Yeah.
Right.
Okay.
I was interested in what is your background?
So I went to medical school in Texas at Baylor, and the Army was nice enough to pay for my medical education. So I got to spend the next 9 years in the Army.
We got a veteran here.
And but I was in the peacetime Army.
Okay.
And then I've been practicing in Las Vegas for about 25 years.
Oh, wow.
Oh, wow. That's, plenty of experience.
So, and if you practice in Las Vegas, you pretty much get a chance to see everything.
I love it. It's good. And, I'm a firm believer of practice makes perfect and practice makes permanence. Right?
Sure.
Yeah.
So what did you say is like the go-to for a guy that's starting to have issues? I'll give you a scenario because obviously you're a doc, so I'm sure everything's a little bit different. But, let's say same partner, but now things just aren't happening the way that they used to anymore.
So, there's the practical things of there's different types of positions, there's different types of scenarios, which may enhance the experience.
Like role playing?
Scenario?
Yeah, role playing.
Okay, I like that. I never break character, by the
way. A couple of things. Number one, women tend to want to have sexual relations late at night, oftentimes right before they fall asleep.
Agreed.
But men do better earlier in the day when they have all of their energy. So sometimes it's a simple thing of just performing when you're at your best, not so much, and especially alcohol, while it can make one feel a little bit more relaxed, also it's a sedative, and so it can
make a limp. You don't want no liquor dick, guys.
Right?
Right. There is such a thing as whiskey.
I believe it. That's experience.
It's funny. A comedian on the podcast just said that, and he said, you never put the two together. But he goes, he's 26, and now he's starting to take Viagra and do all that, and he goes, maybe it's the gallon of whiskey I drink every day.
Oh, that absolutely affects guys' performance. And then once guys have sort of a more consistent pattern where they're struggling to get a good erection, the oral agents like Viagra and Cialis, they've been around for 25 years. They have literally been tested on millions of men. For the overwhelming majority of men, they're very safe medications.
Good.
There is also a new product called Eroxygen, which is a cream that men put on the tip of their penis. It's so safe that the FDA has said you can sell it at a drugstore without a prescription.
Is it edible?
It's
suckable. Or does it make your mouth numb?
You said it was safe.
So it's safe when applied to the skin. It's not really intended to be taken orally.
How do you
once he applies?
So they apply it to the glans, penis, or the head of the penis. And then as it evaporates, it cools and then it warms the penis. So it works completely differently than Viagra and Cialis. And so men can take Viagra or Cialis, and they can also take Eroxygen as an accessory, or they could just use it as a sole product. And it's one of the few things, that how many medications can you say there's virtually no side effects whatsoever. So it's a good adjunct.
Okay.
Yeah.
Now, I remember, I don't know if they still have it, but there was like lube that you could blow on and it heats up. Is that similar?
It's sort of the same principle
Okay.
because it's the cooling with the evaporation and then the subsequent warmth. So what the pills like Viagra and Cialis, they both work through the same mechanism. They're called PDE5 inhibitors. And what they do is they send a signal to the blood vessels in the penis and say, hey, let's open up. Let's increase the amount of blood. The problem with those medications is that they can lower your blood pressure a little bit. And if you take certain medications in conjunction with Viagra or Cialis, it can be fatal.
Like a blood pressure medication?
So the one that really comes to mind is nitroglycerin.
Oh, okay. So someone with some heart issues and they got
So
that.
if someone takes nitroglycerin and they take Viagra or Cialis or any of the newer agents, their blood pressure will bottom out and then they can actually pass away from that.
What about with poppers?
So I don't have very much experience with that.
Curious.
I was watching a show a while back. It's called Big Love, but he took so much Viagra he went blind. Is that a real thing?
You know, there are very, very rare patients that do experience not just visual effects, but they actually can accrue permanent visual damage and also hearing loss.
Wow.
But those cases are so rare, it's almost a case report.
Gotcha.
But there are certain patients that have eye conditions which precludes them from using Viagra or Cialis or the like.
Wow, I didn't know that. I do have a question though.
Yes.
I've heard Viagra could be good for women. Is that true?
So there isn't really much evidence to support that. And so I would say that if women benefit from that, it's more anecdotal. There really are no controlled studies that say, okay, X number of women, if they take it, they will benefit. But one of the most common reasons that men will go on to develop erectile dysfunction is disuse. So
use it or lose it.
I love it.
and as a trader, you can speak to that. If you don't use something,
100%,
it will lose its ability. And so we see in our practice a lot of men who, unfortunately, their partners get ill and eventually pass away. So they may have a period of 3 or 4 years where they're not sexually active. And then when they want to get back into the dating pool, what happens is they don't have the ability to perform the way they used to, just because they had this long period of sexual inactivity. And
so you're saying they should call, if that happens, call Ava in the meantime and keep it going?
Definitely.
Right?
That's a great idea.
I love it. Look how
She's
it
here
all
to help.
works out. Hello, boys.
I did have a friend who was taking a hair loss medication, finasteride or Propecia, I guess. And then he said that it ended up affecting his erections. Yeah. Is that a thing?
And unfortunately, that is 100% true.
So you have to make a decision between the hair or, I mean, it's like, what do you need the hair for if your dick doesn't work?
Exactly.
I mean,
limp dick over balding.
Yeah, exactly.
I mean, you summed it up.
Yes, exactly.
Now, the good news is that 99% of men who take finasteride will not develop erectile dysfunction. It's that pesky 1% we have to worry about. And for
ruining it for everybody, I guess.
Some of those men, actually, the erectile dysfunction can be irreversible.
Oh, that's horrible.
So it's rare,
Really?
but sometimes it does happen.
Oh.
Is that when the penile implant comes in?
Well,
or Trimex?
So
good old fashioned.
Those are great questions.
Okay, yes.
So what normally happens, the most common scenario, somebody develops ED or they have partial ED. And so that's something to keep in mind. Erectile dysfunction's not all or nothing. So sometimes what happens is guys are still get hard, but they're not as hard as they used to be.
Yes.
They're not as hard as they want to be. And so that's partial erectile dysfunction. So you don't have to be completely dead to seek some sort of intervention. In fact, the earlier you intervene, the better. So,
and that's like a David Goggins thing, stay hard.
So, right. So what you want to do is at first, the first step, what is the first step? So the common answer to that is the first step is to take a pill. Mm-hmm. And like I said, the pills have been around for a long time. They're very safe.
Do you have one that you like prescribing over another?
So the two most commonly prescribed medications are, of course, Viagra and Cialis. Mm-hmm. And nowadays, almost everybody uses generic Viagra, generic Cialis. If you get those medications at an American pharmacy, mm-hmm. the compound is identical to the branded product. The difference is cost. So with coupons, you can get Viagra or Cialis for 30 to 40 cents a pill. And the branded products are vastly more expensive, like $25, $30 a pop. So
I think that's what Viagra was in the beginning, right? Like $25 a pill or something like that?
It wasn't, and it still is.
Really?
If you get branded products at a drugstore, you're going to end up paying a fortune.
Yeah.
And so me personally, mm-hmm. I'll take a generic every time.
Absolutely. I like it, right?
Right. I mean, it's pennies on the dollar. It's the exact same compound.
Exactly. So, yeah.
Now, if you ask a urologist, because, urologists sometimes get erectile dysfunction.
They're part of the 50%?
Oh, the urologist
50% of urologists.
Wait, I'm confused.
Urologists are just like every other guy.
The doctor themselves.
Yes.
Okay.
They exactly the same as everybody else.
Sure.
But if you ask a urologist, okay, Mike, you have erectile dysfunction. What are you going to do about it? The most common answer, 80% of urologists say the first thing that I would do to treat my ED is I would treat it with shockwave therapy.
Oh.
So you're right, because why is shockwave?
Sounds intense.
Is it up the butt? Like, is it like a, because there is some things that like you could electrocute your butthole or, I don't know.
That's not really the shockwave therapy.
But tell us about the shockwave therapy and then maybe about the butthole one after.
Exactly.
But I want to learn about that too.
Yes, baby. Yes. Warming up to me. I love it.
So shockwave therapy has been around for treatment of erectile dysfunction, has been around in Europe for about 10 years.
Okay.
And when we found out that it wasn't killing too many Europeans, we brought it over to America. And so what focused shockwave therapy is it's a painless 15-minute procedure where something touches the outside of your penis, feels sort of like a vibration. There are virtually no side effects. I mean, it's as safe as it can be. And what it does is it increases the amount of blood that gets into the penis. It reinvigorates the nerves, reduces inflammation, and it's extraordinarily safe.
Ooh.
And so a lot of guys will respond to just a couple of treatments. The average patient's 6 treatments, but you can go 12 or 18 treatments if you need to.
Wow.
And the results are cumulative. So what it does is, number one, for most men, it makes it such that they don't have to take any pills at all. But there's another group where they've been taking pills. Now the pills don't work. You treat them with shockwave therapy and the non-responders turn into responders. So it's a vast spectrum of patients that can benefit from it.
So it's no surgery. It's just like a...
You walk into the office, you walk out of the office, and you can go work out.
Can you right after?
You can.
Okay.
We recommend that you wait until you get home, but yes.
I do have a question though. So that sounds amazing, right? How come this is pretty much the first time I've ever heard about it?
So that's a really good question. And so right now, as we speak, the shockwave therapy is approved for use in Europe. It is not FDA approved in the United States. So the machine that we use is FDA approved, but the treatment is still, quote unquote, investigational. And so for that reason, insurance companies such as Medicare will not pay for the procedure. So it's a select group of patients who can afford to pay for it that get treated. But it's a wonderful treatment for those who have access to it.
So basically, insurance doesn't cover it.
That's right.
But they do in Europe, huh?
They do.
So eventually here then.
Presumably.
Yeah. Oh.
The question is, almost every guy will benefit from treatment with shockwave therapy.
Wow.
So say you're a guy and you're doing okay.
Sure. Let's say you're a guy.
But you want to do a little better.
Okay.
Would you benefit from shockwave therapy? You highly likely.
Sure. If I was a guy, it'd always be about my butthole. Yeah. I'd be like, how can I get better, harder, faster, quicker?
So the insurance companies are going to have to figure out who they'll pay for it.
Okay.
Because very few men would not benefit on some level.
Oh, really?
Yes.
They wouldn't benefit from it?
Right. So in other words, most men would benefit from it.
Okay.
Yeah.
Okay. So let me ask you this, because once again, it's all about me. Could you do this on clitorises?
That is a wonderful question.
Thank
What a
you,
great
Doc.
segue.
I love it. Thank
Yeah.
you.
She heard vibrating.
Yeah, I was like, hey, what about me?
Yeah.
Okay.
I mean, as you know, the female genitalia and the male genitalia are quite analogous.
Yes.
And so one of the things I was going to mention is what happens to women when women develop sexual dysfunction, female sexual dysfunction. It's much more common than you might think.
Okay.
And so when women develop female sexual dysfunction, they want to stop having intercourse. And so a lot of times then their guys no longer have access to sexual intercourse. So there's a correlation between women having female sexual dysfunction, men having erectile
Then it's
dysfunction.
the use it or lose it thing you were just telling us about.
Right.
So really the woman's starting the whole cycle kind of right there.
So either partner.
I don't know if it's because I'm a guy though, but I always hear about, the guy and the wife won't sleep with him, but nobody talks about their dick not getting hard. So when you said you won't believe, I'm like, no, actually I hear it more the other way around. It's like you and your career. It's like on the under.
Yeah, right.
Takes two to tangle. But you asked me about using this wonderful
back
technology.
to me. Yeah. Okay, yes. For my clit.
And the answer is yes.
What?
There are
plug
because
it.
Here
plug
we go.
It, plug it. Make
trial.
an appointment.
Yeah, we got
Make an appointment.
Yeah.
Now you can't improve upon perfection.
Oh,
but
that deserves a BJ.
But yes, there are women who benefit from it, and the treatment is very similar, and the side effect profile is very similar, and there are select gynecologists throughout the country that use this same technology. It's also used to treat more mundane issues like plantar fasciitis and slow healing wounds.
What if someone has like a stiff ankle?
So
I do.
It's mainly for soft tissue.
Okay.
Yeah.
I was just she got
my ankle's messed up.
Yeah. So I just threw that in there.
So
since you're a urologist, though, can you?
Thank you.
Let's say she hired. Yeah. Let's say she says, Doc, I want to try it out. Well, I'm going to come back on the show and tell everybody how it works.
I'll tell everybody how it works.
Well, they say that you can train a monkey to do surgery. The problem is you can't train the monkey when not to do surgery.
Yes.
Okay.
And so a lot of patients ask me about treating various ailments. And so I'm a one-trick pony. I just stick to urology.
Gotcha.
Is that what you're saying?
Yes.
Okay, that's fine. I get it. I understand.
But it might work.
Okay. Look into that.
And I can say for myself, when I take Viagra, it stuffs up my nose.
Yeah, that's one of the common side effects. Nasal congestion. And so you can get a red face is common.
Oh, so common.
Sort of
their chest breaks out and they go, oh, look how hard you got me. Honey, it's the Viagra. But I get, thank you. Yeah, I got it.
Headache is one of the common side effects.
Ooh, I bet.
And so,
why is that? Because it's rising the blood pressure, or it's lowering?
So it's a PDE5 inhibitor. So the receptors are mainly in the blood flow to the penis, but there are receptors in other parts of the body as well. So that's why it causes sometimes headache. Sometimes it causes gastrointestinal upset. And again, if you take nitroglycerin, you absolutely, you cannot take PDE5 inhibitors because the two things together will bottom out your blood pressure. Also, if you take certain medications for hypertension or prostate pills, it can lower your. So Flomax is an alpha blocker, and so you can still give patients PDE5 inhibitors with those drugs. You
alpha blocker being the opposite of a beta blocker.
It's a little different.
Okay,
a little bit different, but they're both different receptors.
Gotcha. So, Doc, what is your advice for 50% of the guys out there when we know, I don't know, most of them aren't talking about it, at least in my experience?
So men are different than women in more ways than one.
Yeah.
But especially in the sense that women are much more comfortable talking about their personal issues with other women than guys. So guys, the blue noise of guys will talk to other guys about sports, but they won't talk about what's really bothering them. And then especially something personal like their ability to get an erection.
Yeah.
They associate that with their manhood, their value as a man. But knowing that 1 out of every 2 guys right now has some degree of erectile dysfunction, knowing that should make you feel comfortable. And the other thing is...
And what do you got to lose?
Right.
Besides
right. And the other thing is your relationship with your physician, your healthcare provider, whoever that might be. There should be nothing you can't tell.
So don't go to your doctor and lie to him or her? Don't look cool in front of the doc?
Yeah.
That sounds reasonable.
Yeah, don't worry about it.
It's like trying to look cool in front of the therapist. Like, I'm here, but I ain't got no problems.
Yeah. Exactly. and when I was practicing general urology on so many patients, they do kind of feel comfortable talking about their prostate or their urinary stream. And then on the way out the door, as they have their hand on the handle, they say, oh, yeah, and by the way, I might be having a little trouble with my erections. So just relax, guys. And keep in mind, you're in the same boat as everybody else.
Very good.
That's really good advice.
I like it.
Doc, let's say a guy's in that one half, he's the elder dude of every other dude, and he's having an issue. How can they get in contact with you to get some help?
So being in Las Vegas, we get to see a lot of guys from all over the country. And our website is very easy to remember, hardernaturally.com.
I like it.
And so we offer for this in Las Vegas, a lot of guys come to town and they forgot their Viagra or their Cialis.
That's a great service to offer, man, especially. They're going to be out there
Sin
drinking.
City, you're in Sin City.
You
need a hard
next thing you know, you do.
Come on. It happens all the time. Yeah. So they just plug in our website, hardernaturally.com. They can do it online or they can talk to me personally. And they can go pick up their discounted medication in 45 minutes to an hour. And in Las Vegas.
What a lifesaver over here. I know.
In Las Vegas, we do have 24-hour pharmacies.
We do. We still, even after COVID, we still do have some things that are 24 hours. That's for sure.
And the other thing we offer is the Shockwave therapy. And we do see guys from all over the country for Shockwave therapy. And if you're going to have a couple of treatments, what better place to have those treatments than right here in Las Vegas?
So basically they could show up, get some Shockwave, then go pick up their script and then hit the strip and have a good time?
It happens all the time.
There we go. Well, see,
I love it.
Yeah, he's keeping the fun rolling.
Yes. It's always a good time with Dr. Kaplan's around.
And it's a great time with you guys.
Thank
I really appreciate you coming out and do this. Yeah, it was really good.
Thank you so much.
Absolutely.
Absolute pleasure.
Thank you for being here.
And remember, for performance anxiety, call Ava Devine.
Yes, of course. I'll encourage you.
Right. Just give you the encouragement. Then for the Shockwave therapy and the pills, call Dr. Kaplan.
Fantastic.
Hardernaturally.com. Okay. So that wraps up another episode of Ava Devine's Bad Advice. I hope you all had fun. And remember, nothing's off limits. So if you have any questions of any sort, please email us at badadvicequestion@gmail.com. So remember, when you know, you know. And if you want more of my bad advice, stay tuned. See you later.